Breast augmentation surgery is one of the most common performed procedures in the UK. The breast shape does change with time, age, pregnancy, hormonal changes, and some patients may opt to increase the volume or size of their breasts with surgery. Sometimes this can be performed with other surgeries such as an uplift if the patient requires that. For us, a suitable candidate for breast augmentation surgery would be an adult who is physically and psychologically healthy and has realistic expectations. Breast augmentation can be in the form of implant surgery, where an implant or a prosthetic, such as a silicone implant, is placed under the breast. And otherwise, it can also be using a patient's own fat, as we would call it, autologous breast augmentation. It is important to have a thorough discussion with the patient in order to select the most appropriate implant. This involves selecting the right size or volume, the correct shape. Other important decisions will be made, such as where the implants can be placed, and this of course depends on the tissue characteristics of the patient and patient lifestyle, activities, and what sort of work they do. A silicone implant in breast augmentation can be placed above the muscle or under the muscle. An important assessment is the thickness or volume of skin or soft tissue envelope above the muscle. So if this is of sufficient thickness, then the implant is ideally placed on top of the muscle. Breast augmentation surgery takes around 1.5 hours and is usually performed under general anesthetic as a day case procedure. The usual time for full recovery is around 4 to 6 weeks. Of course, you can get to much lighter activities earlier on, but this is the time frame to be able to probably return to the gym and undertake heavier activity. Some patients who may also wish to have liposuction may consider fat grafting to the breast as their breast augmentation procedure. Particularly if these patients also want liposuction, these may be the ideal candidates because they will achieve liposuction in an area of unwanted fat, but also have fat grafting to volumize their breasts. This is a different operation from breast augmentation with an implant, but can also achieve excellent results in the appropriate patient. All types of surgery carry potential risk. Breast augmentation surgery is generally considered safe with a high satisfaction rate and low complication rate if performed safely. Of course, this means that an appropriate consultation must be performed with a thorough discussion and ensuring complete understanding between patient and surgeon and ensuring optimal surgical execution. I personally like to see my breast augmentation patients at least twice for a consultation to ensure that they understand everything about the procedure, and I'm happy to see them as many times as they want. If you have any questions, feel free to get in touch with one of our patient advisors who will be very happy to help you.